I want to get us into this quickly, and so I've thrown a couple of sketches up on the board. Nothing fancy. It's already in your notes, but I want to be able to work off of these as I take you into the kidney and we start to look at the anatomy of this organ. I flipped this around just for convenience sake, all right? And what we've said before is that the kidney gets, what, 20% of the cardiac output, all right? And that blood comes into the kidney via the renal artery. And now that renal artery, once it enters at the hilum, is going to subdivide into branches that are essentially going out to the volume of the organ, right? You have to think of it not as a flat thing, but as a three-dimensional thing. So it's branching out to make sure we begin to supply the entire organ, all right? And what we're going to see is a series of branches and branches and branches, all right, as we take that renal artery and now divide it into these segmental arteries, all right? And I'm not going to write all the full names of these, but I'll try to at least reference what they are. All right, we go out to the segmental arteries, and then segmental arteries are going to send a branch up through the renal columns here, all right? And that branch is running between what? I've simplified my kidney here, all right? It's running between renal pyramids, or more largely you can say it's running between lobes of the organ, right? Because a lobe is the renal pyramid with its adjacent cortex and the renal columns on either side, all right? That's what a lobe is. So this vessel is called an interlobar artery, all right? It's running between the renal pyramids. It's defining the lobes, isn't it? All right? And that's going to give rise to a branch that's going to travel now parallel to the margin between the cortex and the medulla, all right? And because it's traveling along that margin, we can say it's traveling parallel to the surface of the kidney, right, which is curved. It's called the arcuate, all right, the arcuate artery, all right, because it's arcing, all right, as it goes out here instead of coming in vertically here, all right? So we have now a small vessel here, an arcuate, and then that arcuate is going to give rise to a vessel that comes upward and sends out numerous branches, all right? And that vessel that comes upward and, again, towards the capsule of the organ, that's the interlobular artery, all right? So we had renal artery, segmental artery, interlobular, arcuate, interlobular. Did I say interlobular? Sorry, did I goof up? I did. Look at that. All right. So again, renal artery, segmental, interlobar. Okay. Interlobar. All right. And then arcuate, and then interlobular. All right. Okay. And now I'm going to pick up here with a branch coming off of that. All right. That is now a branch coming off of, so let's draw it here, all right? This will be the interlobular, okay, artery. And now coming off of that, we have this branch. And there's going to be many others, but we have this branch, and this is called the afferent arteriole. All right, now we're getting to where the action happens. Right, we've gotten in far enough. Branching, 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 branching. Every time the vessel's getting smaller and smaller, right? And eventually, the afferent arteriole is going to supply the kidney tubule. All right? And we said on Tuesday that there are how many kidney tubules? About 2.5 million total. All right? So there's over 1 million per kidney. All right? And the afferent arteriole then, all right, is coming in here, and it gives rise to a ball of capillaries. And then what emerges from that is a smaller artery called the afferent. All right. I'm sorry. Efferent. Thank you. All right. I was thinking about the word artery here, which should be arteriole. All right. So the afferent arteriole and the efferent arteriole. So we're getting down to pretty small stuff, right? These are very small arterial vessels. All right, and this is a ball of capillaries called the glomerulus. And each kidney tubule is intimately associated with a glomerulus. So there are how many glomeruli? 2.5 million. All right. And the kidney tubule I've drawn here has the following components, and we'll come back and we'll tie these two things together. This is called Bowman's capsule. All right. This is called the proximal convoluted tubule. This is called the loop of Henle. All right. It goes down, comes back up. This is called the distal convoluted tubule. All right. Distal because it is further downstream, all right, from the glomerulus. All right. And then this is called the collecting duct. All right. When we look at it here in the kidney, where it really sits, all right, you can see that the glomerulus, the Bowman's capsule, the proximal convoluted tubule, and distal convoluted tubules sit out here in the cortex. And the loop of Henle does what? It descends downward into the renal pyramid. Okay? All right, so we've got the orientation here. So again, I've labeled this up here. This is cortex. This is medulla down below. Here you see it here. This is cortex. This is medulla. Our blood supply has taken us all the way to the efferent arteriole. Let's finish off the blood supply just so we know it's there and we won't draw it in the next time. All right, I put this back up in a moment. All right, so afferent arteriole gives rise to the glomerulus. The glomerulus ends up draining through an efferent. So we have an A here for approaching. We have an E here for exiting. All right, and now the efferent arteriole is going to do what? It's going to form a system of capillaries, all right, that are going to be surrounding these tubules. It's called the peritubular capillary network. All right, peritubular capillary network. All right, so that sits up in the cortex, doesn't it? And it is a set of capillaries that is going to allow for oxygen providing to the proximal and distal convoluted tubules. And as you're going to see, there's going to be interaction between what's in the kidney tubule in green and what's in the blood supply here in the peritubular capillaries. All right, there's one other vascular component, and that is an extension off of the peritubular capillaries that's in the form of a loop of capillaries, and this is called the Vasa recta. The Vasa recta, which means the straight vessel. All right, and what do you think it's doing? It's keeping the loop of Henle alive. All right, delivering nutrients to the loop of Henle and delivering oxygen to the loop of Henle, but it is also going to play an important role in how this organ functions, as you're going to see. All right. All right. One last thing. Then I'm going to erase all of this. We're going to start over again. Okay. And that is that if I have all these kidney tubules extending their loops of Henle down into this pyramid shape, all right. Let's imagine. If you, just to keep it simple, you take a bunch of sticks of spaghetti, uncooked, all right, and you lower them down into a cone-shaped space. You know, can they all fit in the cone-shaped space? No, because it's getting narrower, right? So what you're going to see is that when we look at the kidney tubules, as shown on the screen up here, the vast majority of them actually don't have a complete loop of Henle. All right? So the vast majority do this. They just come down and back up again because there isn't enough room down here to accommodate all those loops of Henle. All right? It doesn't matter. All right? If you just have 20% of the kidney tubules descending down all the way down to the bottom of that renal pyramid, the job that they do is accomplished, and the others can simply utilize the benefit of that. All right. So I'm going to show you those kidney tubules that have this complete loop of Henle, all right? They're called juxtamedullary. Juxtamedullary because juxta means they sit adjacent to and all the way down to the medulla. All right, juxtamedullary nephrons versus the 80% that don't send a long loop of Henle, and they are simply called cortical nephrons. All right, cortical nephrons. So the vast majority of nephrons of tubules are cortical, but you know what? Those cortical ones, as you're going to see, are going to do everything that the juxtamedullary do, with the exception of one function, but they'll rely on the other guys to do that function, so it works out fine. All right? So there's our initial layout. You've got the blood supply then, afferent, glomerulus, efferent, arterial, Bowman's capsule, proximal, convoluted tubule, loop of Henle, distal convoluted tubule, and the collecting duct. Let's say one or two more things here. All right? If you were to look at the diameter of the efferent versus the afferent, you'd find that the efferent arteriole is about 15% smaller in diameter than the afferent arteriole. All right? So if you have a tubing and then you couple that into a smaller tubing that has a smaller diameter, what's going to happen to the pressure at the juncture between those two? It's going to increase because there's back pressure, right? All right? So that's what's happening here. You have a situation that creates back pressure, and that back pressure is relieved by blood plasma leaking out of these delicate capillaries and being captured by the kidney tubule. All right? And the function that's occurring here is called filtration. All right? Filtration means that we're relying on hydrostatic pressure, on the difference between the blood pressure as it flows in this larger afferent arteriole and the restriction as we go into a smaller vessel. It's creating some back pressure, and we relieve that by allowing fluid to leak across that little ball of capillaries. All right? And plasma will leak across that. All right? Absent of blood cells, absent of large proteins. All right? And so we will call it a filtrate of the blood plasma. All right? It's a filtrate of the blood plasma. It's a subset of the blood plasma, lacking big proteins, lacking blood cells, formed elements. All right? So what color is it going to be? Clear. Straw-colored if you want, the color of plasma. All right? Clear, essentially. All right? It's called filtrate. It isn't urine. All right? And it doesn't become urine until the collecting duct reaches down here, all right, and opens up into the minor calyx, all right, at the very tip of the renal pyramid, and the very tip of the renal pyramid that pokes into the minor calyx is called the renal papilla. The renal papilla. Remember that? The renal papilla. So the renal papilla is going to be like, think of a colander. I have one at home, a nice stainless one that's got lots of holes in it for draining my spaghetti, right? And if I look at it from underneath, I see this dome-shaped thing, right? With holes all over the bottom of it. That's what the renal papilla looks like. All right? It's this little, poking out end of the renal pyramid, and it's perforated with all these holes. And you know what the holes are? The holes are the end of the collecting duct. All right? You got it? When that filtrate that is going to be generated here travels through the proximal convoluted tubule, through the loop of Henle, through the distal tubule, and then drains into the collecting duct and leaves this into the minor calyx, it is now called urine. All right? Prior to that, you can call it filtrate or you can call it presumptive urine, as in it's eventually going to be urine. I prefer you just call it filtrate, but some folks call it presumptive urine. Okay, all right? Okay, I think we're ready to dive into it here.